Varicose veins are a problem shared by millions of women and men, but as we've come to learn, they can also lead to other more serious problems if left untreated. Back with us today is Dr. Dan Mountcastle from Mountcastle Vein Center and Hanny Bodner, one of his patients. Welcome, both of you.
Thank you.
We're so glad to have you. Dr. Mountcastle, we talk a lot about the medical problems that can come from varicose veins or can be the cause of varicose veins. Varicose veins are not in and of themselves a lot of times the problem. Is that correct?
Correct. Everyone knows that varicose veins go to vein doctors, but they don't know about these other problems that are caused by the same valve failure that causes varicose veins. Swollen legs, restless leg syndrome, night cramps, aching, tired legs.
And we've talked about restless leg syndrome before, but today we have Hanny with us. And what was Hanny's problem when she came in to see you?
Hanny had aching, tired legs. She'd had a couple of procedures done before that failed by other doctors, vein stripping, which is kind of old-fashioned now, and she had swollen ankles.
Okay. And what does that mean? What is it, they just appear swollen and ache, or is there something more to it?
Edematous swollen ankles. And there are thousands of women in our area taking diuretic medicines, water pills, to get rid of their swollen ankles. And that's fine if they have a problem with their heart or their kidneys or their liver, and they need these diuretic medications. But thousands don't need them, can throw them away. And they should. They can cause an increased risk of stroke and loss of minerals and cause fatigue. If you don't need those medications, you shouldn't take them.
And Hanny, you did start with the vein stripping. How painful was that for you?
The vein stripping, when I had it done before, was very painful. And I had to rest for a long time. And the doctor, there was no pain. And the second day I could walk, and it was wonderful.
What finally brought you to Dr. Mountcastle? How did you decide, that's it, I need to really get this taken care of?
Doctor had a seminar, and we went to see it, and I was very impressed. And I said to my husband, I think we should go and see the doctor. And I went there, and that's why I stayed there, and I'm very happy I did.
And how quickly, you said you were able to walk the next day?
Next day, yes. You have a pain, there's no pain, I wouldn't say there's no pain at all, but a little bit, but nothing to say that, oh, I can't take this. So anybody who needs to go back to work the next day, he can go back to work.
And how common, Dr. Mountcastle, is the kind of problem that Hanny had?
It's really quite common. It's very common, and all these vein problems are caused by the same thing, failed valves. The vein system is like an upside-down tree with valves every 6 inches or so, and if they fail, everything below is under pressure. And the branches of this upside-down tree become varicose veins, not only outside the leg, but inside the leg. You can have terrible varicose veins and see nothing on the surface. And the capillaries and small vessels, the twigs of this upside-down tree, leak fluid all day long with protein and blood cells and causes swelling. And so, if there's nothing wrong with a person's heart, liver, or kidneys, they should have an ultrasound of their legs and see if this is the problem, and it can be easily fixed in our office.
Well, Dr. Mountcastle, we're going to take a look at some before and after photos that we have from you that are just absolutely startling, and see some of the problems that you're able to deal with. What are we looking at here?
This is a gentleman who was 38, came to us, and we did a simple procedure, started an IV down below his knee and put the laser fiber in, pulled it back over 3 minutes, put a Band-Aid on the puncture wound, and asked him to come back in six months. He lives in California. And I would do further procedures. Well, you can see there was nothing left to do. All the veins, when the pressure was taken off of them, just deflated.
So one treatment and a Band-Aid.
One treatment and a Band-Aid. He couldn't believe it.
And what are we looking at here?
This lady was in her 50s. And we did the same treatment we did on the gentleman. We took the vein out behind. And this vein on the left shrank quite a bit. But she wanted it to be perfect. So when we did a simple procedure where we worked through a needle puncture about every inch along that vein and pull that out. Again, it's in the office about 45 minutes and it's painless. This is a young woman. We mark the veins before we do this phlebectomy procedure where we make the small punctures. And this is as we marked her just before her procedure, and this is about a month later.
Wow, it's absolutely incredible. I mean, that the leg, not only does it look, you know, healed, it looks younger too from the procedure. And
they feel younger. These are legs that don't ache anymore. This is a lady who wanted to date younger men. She's 84. She said the fellows her age are just too old. And so we did the same procedure we did on the young man, and then took the surface veins out, and her leg looked great. This was a state trooper. Both legs were like this on the back.
And this is somebody who's going to need to be mobile, who needs to be able to get around and move around quickly, and that looks absolutely painful.
Not only that, but he likes to run. He runs 6 miles a day, and he's back running again, so he's happy.
That's unbelievable. And finally?
This same woman I think we showed earlier, this is only 1 week after procedure, so it's a little bit bruised, and there's a few punctures there. They all healed up. I saw her just last week. Her leg, you can't tell that there was ever anything wrong with it, and she's happy as can be.
That's amazing. Yeah. Now let's just take a look at how your ankles look now, Miss Hanny, because they look just perfectly normal to me, and they must have been very, very swollen when you were dealing with the pain.
Yes. I had cramps at night too, and I don't have them anymore. It's just been like here. This was very swollen here, and you can see now it's nearly the same now.
You should join the Rockettes.
Thank you.
You look beautiful, and I'm sure it's so much nicer. You must be a lot more mobile too now. You're more active.
Oh yes, I couldn't walk anymore because my shoe was so tight that the ankle was so swollen that I wasn't comfortable. So now I'm back to normal.
And you learned about Dr. Mountcastle from one of his seminars, and you've got another one coming up that we want to tell people about.
21st at the Isla del Sol Yacht and Country Club. It's 11:30. Please call our office and our SVP so we can tell them how many people to expect. Come and be our guest. And I'll talk for about less than 10 minutes, I promise, and answer questions the rest of the time. People always have a lot of good questions.
And you can find this information at studio10.tv as well if you're looking for it. If you happen to not have a pen right this second, but that number is 727-865-6941 or mountcastleveincenter.com.